Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing some of the Medicare assistance programs that are available to our beneficiaries that can help them with expenses that are incurred outside of or in addition to their medical coverage. We'll be spending a great deal of time with some specifics. So there's going to be a ton of information that comes to you. Don't be concerned, because today's presentation is being recorded and will be made available on our website at premiersmi.com and on our YouTube channel as well. So it'll be there for your use and for your reference. Additionally, all of the agent success managers, your marketers within Premier Marketing, will have access to the programs as well. So you'll have the detail there for you. There are a number of different presentations within a presentation that we use within the community, I think, that will be helpful for you, that will be available to you as well. You'll notice in the software package there is a section for both questions and chat. We ask that you put your questions in the questions box. We find that we do address most questions through the course of the presentation, but if we don't, I want to make certain we get you an answer and get you the maximum value out of the investment of your time today. Which, by the way, I thank you for spending time with us today, the day after the end of the annual election period, where many of you are probably heavily sleep deprived and need some, a little bit of rest, we'll put it that way. This, however, I think can be a key component of your marketing programs for the remainder of the year. We still got 3 weeks in December and throughout 2023. We have a planning webinar tomorrow that I think this can be incorporated into very easily, and will be referenced to that as well. These programs that we offer in this style are aimed at a number of different familiarity levels with both the programs and with the, pardon me, I had something interrupt us here. So they appeal to agents of different skill sets and that sort of thing. So some of it might feel a bit remedial to some people. Some people might think, gee, you're getting into a great deal of depth there, but bear with us, we'll work through that. And I say that simply because there are some folks on the call that I don't recognize the name of, and so you might not be as familiar with Premier Marketing. So I think that might be a good place for us to start as a level set. We are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We're licensed in all 50 states, acting as an insurance wholesaler through independent insurance agents such as yourself, through contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. I mention that because we look at a number of different programs to access the public, the buying public, that is our lifeblood in what we do. And that is part of an overall portfolio of products that include the Medicare programs that are so greatly affected by the programs we speak of today, the Medicare Advantage, Medicare Supplement, and prescription drug plans. But we also have a full portfolio of life insurance and annuity products, final expense life insurance pre-need plans, long and short-term care programs, disability income plans, and ancillary benefit plans to address specific needs. When we look at the Medicare Advantage plans, this is a key component as part of our discussion today, because many of the national carriers that you see here, and many of the strong regionals as well, will have different components within their organization that help support our efforts in getting the gospel out, in a manner of speaking, of these assistance programs. And they can be a very valuable resource for us in making certain what we do in this area is not only effective for our prospects and our clients, but makes financial success for us as well. So it's a perspective we want to carry through, and that same philosophy within the prescription drug programs that are, in most cases, part of the MA contract that you have, with a couple notable exceptions. The Mutual of Omaha program for their PDP plan, their prescription drug plan, is a separate component from their other programs, and CleverRx is actually a discount program. When we look at the Medicare supplements, this can be a factor within what we talk about today, even though a lot of times we look at Medicare supplements as the higher income people within Medicare. Kind of a misnomer there, but you have a great selection of programs here and a number of very effective tools to help you be successful in this space. And it too then can help you market your MA and PDP programs and vice versa. The ancillary products in each of those categories, we have the national leaders there for you. It gives us a lot of marketing flexibility because these programs don't have some of the same regulations and oversight. It also gives us that opportunity to address the specific needs of our prospects and clients, and gives us another way of creating revenue for our agencies as well. We won't spend a lot of time on the marketing opportunity because you just come out of a big piece of it. But when you look at this, we realize the number of people that are aging into Medicare, the fact that some people are deferring accessing the benefits right away, and that's more than made up for by the folks that are under the age of 65 that are accessing Medicare benefits because of a disability. That group can be a very key target for us in the need of knowing how to and how these programs work for the population we serve. And even though you may feel like, boy, we've talked to a whole bunch of people over the last few weeks, the vast majority of people on Medicare don't compare their plans year over year. These programs that we have with the Medicare Assistance Program give us an opportunity to reach out into the community and make certain that we help people who didn't review their programs realize that they need to review their options and utilize some of the things that can make a difference for them when it comes to the bottom dollar, how things are affecting their wallet. And it's the same thing if they're in an incorporated drug plan in a Medicare Advantage plan or a standalone program. They're just not doing the reviews as they should. If you think about it, are you going through your own health insurance in great detail every year? Some of us do, some of us don't. The mentality within the population we deal with here, a lot of it is, well, I'm comfortable with it, it's working for me, and they don't realize some of the financial ramifications of that. We also want to make certain that because these programs are very acronym heavy, how do we communicate properly with our prospects and clients and make certain that they understand what we're saying in a manner of speaking here? And you'll see that this piece taken off of the CMS website, gee, it's a listing of 4,420 acronyms. A lot of detail we need to translate there. It also reminds us that if we can keep our use of acronyms to a minimum, we're going to be able to better communicate and better understand each other. So in each of the choices that people have, we have assistance programs that can make a difference for them. For some of the people that have opted into a standardized, modernized Medicare supplement plan, well, they're going to take a drug program. And some of those folks are going to be paying for that med sup on a tight budget. So if we can help with some of their expenditures, it's going to help those people. You'll have some people, they're only going to take out a Part D program for one reason or another. And it obviously, the extra help programs can make a big difference as to the cost that are associated with the plan, no matter how that plan is set up. We'll go into detail on that in a moment. And then, of course, the Medicare Advantage plans, when you integrate the prescription benefit into the health plan itself, well, a big determinant as to what plan may be most effective for an individual comes down to prescription cost in certain areas. And this can make a big difference in that area as well. We just finished the annual election period. We're going to be going into the whole OEP coming up at the first of the year, how we can market, how we can't. We've got election period webinars that we're doing that as well. But in each of these areas, the programs we offer create one of these lovely things, the special election period. And when we look through these standard 20 that we see year in, year out, a whole bunch of them deal with medications and cost and dollars. And you have additional programs that are rolled out, special election periods for special circumstances. and many of the carriers are very good about communicating what those are, and that gives us a further opportunity to reach out into the community and offer not only our assistance in the plan comparison, but how we can maximize the value of the program they select and how we can make that the most cost-effective option for them as well. Some of the carriers do a really, really good job of getting a specific detail. So if you are in a particular area and you have a question as to, wow, is there a special election period in my market? Well, that's where your agent success manager with Premier can be a great value to you, because one, we can supply you this information, but we can also help you detail as to what is available, how can I help people on an ongoing basis throughout the year, because quite frankly, that's what we're facing now. You have hopefully a little bit of peel back on some of the commercials on television, but there's going to be, they're going to be there year round. They might change their slant a little bit. We also face the pressure we have with different call shops dialing into people. So if we're able to make certain that we can address the questions those efforts provoke in our folks that we speak with, and we can speak to them as to, okay, you have an opportunity to change coverage, but here's your options, plain and simple. It can make a big difference, because they're not reading their ebook or their paper version of this that's sent to them with the Medicare and U book. A whole bunch of folks aren't using the Google app that's available to them through the App Store. The lovely pieces that are out there to help explain these programs, well, they're not being watched online either, be it basics or some things specific to our conversation. So when we're looking at the population that's affected by these assistance programs, we're not necessarily looking at a true dual as it's laid out on this particular slide. This is an opportunity for some of the special needs programs, the dual special needs programs, but it gives us an opportunity to look at and realize the sheer number of people that are affected by dollars or lack of dollars or not enough dollars, or however you want to say it, and how this is a genuine way of helping the community and driving our business. And we want to be able to deliver it in the manner that the folks want. So if they want it delivered in person with some of the lower income people that may not have some of the web access or whatever, that's the way it's going to be. But we have a portion of this population that is sometimes referred to as the near poor, that is very, very adept at virtual presentations. So we can do a lot of what we want to do in a very time effective way, switch back and forth, be a hybrid in certain areas if we need to, because they're trained to do it. Ever since the pandemic hit, we're trained by all of our providers, our doctors, our specialists, our dentists, the hospitals, even our faith-based families have made it a less frightening procedure for folks that aren't as accustomed to some of the use of the internet. And it gives us then the opportunity to maximize our time, because when we deal with these programs, they are heavy numbered, and sometimes it takes a bit of time. We want to make certain that we're utilizing our most valuable resource in as most expeditious a manner as possible. So finally, let's talk about these assistance programs and now how they're going to help us sell and keep our business throughout the year. And that brings up the big question of, gee, John, it's the 8th. Why are we doing this right away? Well, because this is one of the things that you can utilize right off the bat with people that you talk to that enrolled with you or did not, and reapproach them with, okay, one of the things that we do as a courtesy to the folks that we've talked to over the last few weeks is speak to them about different programs that can enhance the program that they're already on. And it gives us then that opportunity to go into different detail that may have been prohibited by what has been on a scope of appointment. And we can then go into these assistance programs that can help them with these costs. It solidifies that relationship because it gives us an opportunity to once again cross-sell through some of the things that we discover through the course of that presentation. It strengthens that relationship. You know, the studies are out there that the more policies that you have in a household, the stronger your retention is going to be. And it doesn't have to be with the same company. It just has to be with the same agent, and that's you. And that can make a huge difference simply by going back through the people that you've already talked to. And I want to reemphasize the fact that because of this approach, it's the people that you sold and the people you didn't. So you have a second shot at business for folks that you've already spoken with, and give you an opportunity to go different areas within the portfolio of products that you offer. And when you do so, and you do so in a manner that is professional and yet gives them the information in a manner that they can understand, they're going to talk to their friends and their family and their neighbors about you and generate additional people to speak with through the referrals that they're going to drive to you. So it makes a great prospecting advantage for you and gives you the opportunity to go through and utilize this as a, here's my end of the year campaign. I'm going to go back to these folks and I'm going to speak to them about the different programs that are out there that can help them with expenses, and how that then can drive additional business for you immediately or throughout the year. When we look at the programs that we discussed today, the Low Income Subsidy, LIS Extra Help Program for the Part D programs, and the Medicare Savings programs, the MSPs that are out there, these are for folks that will, well, they have to qualify, obviously, from on an income and assets basis, but it gives them then the opportunity to maximize the benefits that they're on. So if you don't have a SEP available, a special election period to help them change, well, thinking on one of these programs you do, you got an opportunity, one per quarter for the first 3 quarters, to change coverage then as well. And by layering this on, it's going to make any program that's out there all that much better, because it's going to affect the overall cost of that plan. It's going to affect the co-pays that are part of the program that they're on, and the ones that you suggest, co-insurance, coverage gap, and the RX benefit, even some of the catastrophic coverage cost if it gets that deep. And that can be a huge difference for folks that are heavy utilizers of medications or medical cost as well. Plus, if you have some folks that, well, we talked about that, you know, a whole bunch of people don't review their plans year over year. There's a good portion of the Medicare population that didn't do anything. And in not doing anything, if they didn't take out a Part D, or they didn't pick up their Part B when they were first eligible, you know, they have the enrollment penalties. These plans can take care of that for them. And that can make a huge difference as to their day-to-day living throughout the month. They have, sometimes you have more month than you have dollars. Well, this can take advantage of the programs and address that issue. And how's that going to make you look? That's going to make you look like the hero you are, because you're going out and helping them address these issues that can be a really sore point to them. It is important to note that these plans, or these programs, however, do not affect the setup of the plan that they're on. So a lot of times folks will say, okay, I'm going to deal with a low income subsidy program. It's going to help with the cost. Well, it doesn't affect the plan formulary. So the list of drugs they deal with on the plan that they're on is still going to be the same. That may well not be appropriate for them because they didn't do a year by year comparison. Their drug use might have changed. Well, gee, there's an opportunity to do a review. It doesn't affect the way the plan set up step therapy or quantity limits either. And so that also is an opportunity for us to look at the medications they're on, and is there another option for them that will better address their needs in that area. And it's all because of how we utilize some of these programs to give us that opportunity to change. It does, however, do a bunch of wonderful things for you and your client as well, in the fact that, hey, you're doing the best that you can for your prospect. You've got their best interest in mind by your actions, and by doing so, it affects the best things for you as well. It enables more sales opportunities. If you are doing this with someone that you've enrolled into a product, by making them aware of these programs and whether or not they qualify for them, boy, it's going to make it harder for anybody to come in there and try to bump you out. It's not going to happen with the same frequency as it possibly could otherwise. It does then too give you that opportunity for those folks that, gee, all of a sudden my drug went from tier 2 to tier 3 or tier 4 or tier 5 or whatever it happens to be. The expenses went way up on it. Well, it can affect those costs. It can really make you better suited in that area too. And if it's someone you didn't sell, it creates that special election period, so you can do some different changes. It's going to increase that prospect pool overall. It gives you an opportunity too to help you effectively manage your time, because with a portion of this population that is accessible to or has access to the internet and information, you can do a lot of things virtually, and it really helps manage your time, drives down that windshield time, all those different things that can really suck the time out of your day, and you can do an end around on that, so to speak. It does also give you that opportunity to easily ask for referrals and get them, because it's well, do you know of other people that these programs might help? Boy, yeah, my brother-in-law, whatever, will have them call me, because you still have that do not call shtick you have to deal with, but it gives you that opportunity to drive that business as well. And because a lot of these folks that are affected by this may not be even aware of the existence or their eligibility for these programs, they may have a different mindset for folks that are accustomed to dealing with the true full dual beneficiary and some of the mindset that comes with this. It gives you an individual that is open to the ideas, open to do business in other areas as well, and once again go back to get you those additional referrals. When we look at some of the different pieces that are there with the Medicare savings programs, this gives us then too an opportunity, depending upon the qualifications of plans in your market and the carriers that you work with, it gives you an opportunity to change an individual from their current coverage to one that might be more effective for them on a cost basis. And then, of course, depending upon how they qualify, it may well qualify them for that dual special needs plan that is so benefit rich. It affects all those costs as part of their, not only their prescriptions, but also the dollars that come into play when they access care at a doctor or another provider of that ilk. Once again, though, it doesn't affect the plan basic rules within the plan. It affects the costs that are applicable. When we look at the low income subsidy program, which is the piece that helps with the medication cost, it obviously gives some people greater access to prescription drug coverage. What do you mean by that, John? Well, just because a doctor prescribes a medication for you and you can pick one up at the pharmacy doesn't necessarily mean you can do it. For some folks, if it's an expensive med, they don't have the money for it. This can make certain that they can be more adherent to the regimen that's prescribed to them. It helps them with that donut hole that doesn't exist, but is an area, a time of higher cost participation. It too waives the late enrollment penalty for Part D if they didn't take it. Well, you have that opportunity for that special election period. And by helping people qualify for low income subsidy, it sets the chain or the train in motion when it comes to qualifying for those Medicare savings programs. You don't necessarily want to wait for that to happen. There are things that we do in other presentations that help with how you can get that going. It's actually this one a little later. So it's a way for us to really enhance coverage now for the folks that we're already dealing with, give us the opportunity to enhance enhanced programs for people we haven't done business with, and once again, get those referrals in play. For someone to be eligible for low income subsidy, they got to have Medicare Part A and or Part B. They got to live in the United States, the 50 states or District of Columbia. They got to meet certain financial criteria, an income test based on federal poverty levels, and a resource or assets test. We'll get specifics here in just a minute. There are some folks that are deemed eligible automatically because they have other needs-based benefits. So if someone has an MSP, a Medicare Savings Plan, they have assistance for their prescriptions through the Extra Help program as well. For folks that are on Medicaid or some heavier assistance program, they have it as well. So they don't have to go through and reapply. These programs are an annual type of program, so eligibility can change year over year. The dollars that come into play, the limits do change. They go up a little bit each and every year. So for some folks, well, if this big Social Security hike comes through, it may well be the thing that knocks them off assistance programs. So there's some things we need to be aware of as to, okay, are you a full qualifier for the low income subsidy or are you a partial? We'll talk about that in a second. The dollars that come into play, well, it affects the base programs for Part D plans. Now, most of us, when we do an analysis of the different prescription drug plans that are out there, unless someone is going for the least expensive plan just based on premium because they don't use drugs, the government has, of course, that structure set up for the base Part D plan, where you've got that annual deductible that in 2023 goes up to $505 a year. You've got that initial coverage period, which is $46.60, up nearly, well, $230 over this year. You have the out-of-pocket threshold, that MOOP of sorts, that has gone up. So the more dollars come out of their pocket in that particular circumstance. And you can find out basically if someone has these assistance programs through a discussion based on what they're paying as a copay. Because you have dollars and cents in this particular circumstance, and you don't normally see that in a standalone drug program. So it's a way for us to determine, well, gee, through what you're telling me on the cost of your drugs, this may already be in play. If it is, well, gee, then you get that set for that first 3 quarters, remember? And of course, most of the carriers out there also have, through their producer help desks or assistance programs, a way for you to check that way as well to see if the program is in place. And as importantly for us, as we go through and look at a sales opportunity, have they already exercised that special election period for the quarter in which we're marketing? This gives you a little bit of an overview of some of that same information. Some people respond better to pictures than words. It is important to note too that the number of plans that are fully covered by the cost of LIS have dropped once again for 2023 over 2022. Not a huge number, but you'll notice that that's a specific number of programs, and it gives us then an idea of knowing that because folks, if they don't apply for a drug plan themselves and they have one assigned to them, there are still some folks that do that. They may be rotated in a program that requires them to come out of a little out of pocket, possibly, if they weren't utilizing benchmark programs. And these are the plans that cover that premium in total. And it is a cost that varies from year to year and can make a big difference as to whether or not someone is fully covered under this. Now, someone, if they qualify for low income subsidy at 100% and they pick a plan whose premium is above that benchmark, well, they are liable for that difference. They're going to be billed for that difference and pay that partial premium if that's the case. That gives us, however, an opportunity to go in once again and do that evaluation, look at the plan they're on. If the premium is higher and we have access to the same medications on the formulary and some of the other pieces that may have predicated that decision on a plan that's below the benchmark, and we introduce the low income subsidy assistance programs, boy, you've taken them out of an out-of-pocket expenditure they don't really need to do. And as I mentioned, that does change year over year, and we see once again the drop in the number of plans that are available as fully covered. There are some other things that will affect a person's choice when it comes to drug plans. We mention these because they're not really affected. Well, they are, but they're not by low income subsidy. But we see a lot of movement within the pharmaceutical arena where drugs are being, I'm trying to think of a politically correct way of saying this. They have more than one application for more than one illness. And sometimes if it's an off, not the primary reason why that drug is being prescribed, it may create some challenges within the wallet, because a lot of times when that happens, they raise the price of the drugs. That's just the way it works sometimes. And you'll see a number of companies now offer preferred and non-preferred generic drugs. So it can be a difference in tiers there as well. And this can cause additional expenditure on the part of our prospects and clients. And we can help protect them from some of these market changes by the use of this subsidy program. We look at some of the different pieces that come into the advantages of low income subsidy. Well, it's going to do some things for folks to take care of those premiums and lower those deductibles and lower the co-insurance and those sorts of things. And that gives us then that opportunity to maximize the value of the plan that we placed them in, or give us the opportunity to do an evaluation of the programs that are out there based on their current status. What meds are you taking? All the review things that we've done in nauseum over the last few weeks, it may feel like. Well, that same type of opportunity presents itself with people that we run across, that all of a sudden, boy, I'm dealing with drug costs. And we'll find a bit of sticker shock, in a manner of speaking, in January, when some folks that didn't do a review all of a sudden discover, well, some of my drugs have changed off the formulary, or they've changed tiers, or the cost have changed. And that gives us the opportunity to use this to address it and visit with them. It is, of course, that opportunity that, once again, gives us the chance to sell year-round on these programs because of that special election period. For those of you that have been involved in this part of the market for a period of time, you may remember it hasn't been all that long ago where folks could change each and every month. They changed that to that quarterly for the first 3 quarters of the year, so it's a bit of a difference moving forward, but we still have that latitude to help people. You do have a couple of layers of assistance within the extra help programs, within low income subsidy. And these are for folks based on their income, where they may be fully subsidized. And these are the folks that have less available dollars and resources. And then, of course, there's the help for people that don't fully qualify for assistance, but it still gives us some help. And what this does for us is, keep in mind, a lot of times when we talk about the Medicare savings programs, we're dealing with people that go up to, at most, 135% of the federal poverty level. When you're talking about extra help programs, you have an additional 15% layered on that. So you can go up to 150% of federal poverty level. So you're reaching out to more people. You have the opportunity to do so. And you're reaching out to people that may have, even though they want to save dollars on the cost of their medications, discretionary dollars to address other needs that they have within the insurance world, within your portfolio. So is it a final expense program? Is it a need for a dental plan? Are they aware of a health history within their family that has them concerned with critical illness or cancer plans? So it gives us that opportunity in that higher of the low income people to have dollars for other programs. This is kind of a scary statistic, in the fact that, 6 in 10 in a standalone drug program, they're going to pay more if they don't have low income subsidy in play. And this sort of discomfort that comes as part of that dollar. That's kind of, not a good way to say that, but it gives us then that opportunity to speak to people, and they are more open to a discussion if we're able to help them address that additional cost. So for those folks that have qualified for full extra help, it takes care of that premium, as I mentioned, as long as it's below that benchmark dollar amount. It eliminates any deductible that might be present in their insurance plan for their medications, and it standardizes their co-payments for their medications. So 100% of federal poverty level and above, it's $415 for a generic drug, $1035 for a brand name drug. Keep in mind, if you're going to go to Kroger or Walmart or one of the pharmacies that offer a $4 copayment, what are they going to pay? They're going to pay the lower. They're not going to pay that $415. They're going to pay that $4. But we want to make certain that we can contain those costs in a manner most conducive to our book of business. It does also tell us that if someone is paying nominal copayments for their medications, they are people at the 100% of federal poverty level or below. These are folks that may well be a very valid prospect for you for a dual special needs program. It does in this area too eliminate that catastrophic limit copayments that the heavy utilizers may run into more quickly than some of them wish to. The partial help, well, it takes that deductible down from that, what did it go up to? $505 down to $99. You have co-payments that are squished down, kind of, so to speak, and what they pay depends upon where they are in relation to that federal poverty level. So this is an area that a whole bunch of people that qualify for this, they're not accessing this. Our going in there drives down some of the out-of-pocket expenditure. And I don't know about you, but if I see a nickel on the street, if I see a penny on the street, I'm going to bend over and pick it up. Just because someone has some dollars, that doesn't necessarily mean they want to spend them. And if we're able to help them save additional dollars, we're creating a premium pool for other programs in many circumstances. A nice clean sheet for you here as to full subsidy versus partial subsidy with the annual income and the resources that come with it. So this can make a big difference for you, and you can see how it went up year over year, not only the income, but the assets test as well. So some things that can help you there, and this is a one-sheeter that you can keep in your presentation booklet or with you so you have a point of reference. And that same thing carries through for the full gambit of the assistance programs and what they cost. A nice way of making certain that you have those dollars, and it gives you the opportunity to speak in specifics with different individuals based on what their circumstance is and the category they fall into. These are some different pieces that the National Council of Aging comes out with for us. I haven't seen them yet for 2023, but these are 2022 ones. These are really nice pieces to have with you on in your presentation book or at your reference online. So it goes through and it speaks to the continental United States, how it's affected in Alaska or Hawaii because it's higher income assets there. And it's a great way for you then to realize that, hey, I may be able to help them apply for extra help. And you can do so compliantly as their advocate through the Social Security website. You can do this on paper. Boy, if you're going to do this on paper, I'm going to shake my head at you and go, why are you doing that? If your handwriting's anything like mine, you need a rooster to kind of translate it. I used to carry paper forms all the time because if I was in an appointment and they didn't have time, or I didn't have time because of my schedule to do this when I'm directly visiting with them, well, this gave me the information. Then once I got back to my office, my home, or whatever, or however you work out of your work situation is, you can do it independent of them and they receive all the information. It is an opportunity for them to get that in play in that fashion, and you can do that for them. It takes a little bit of time, but the more, it's like everything else, the more you do it, the quicker you get at it, and it helps you be that source for them. This is one of the things that makes you referable, and of course ties that person to you, because you can send them to a benefits checkup line. You actually have a number of carriers that will fund part of that, and they kind of white label those programs. But if you send them to some of the other places for someone else to do the work, you're ceding control of that prospect, and you don't necessarily want that to happen, because, well, benefit checkup, you're going to go through the internet or whatever else on some of the different stuff there if you're not going through a carrier to do it. And we all have a varied opinion on SHIP programs and how they do business, and how if we do send someone to a state health insurance assistance program, we're losing control of that prospect. Some of the things you want to consider when you look at the process of applying for this is obviously online. Everything we do now in our world, it seems like it's a push to online. There are carriers that only take applications electronically. There's good reasons for that, obviously. You don't have to worry about our handwriting. At one point in time, when I had the central region for special needs plans with a carrier, over 70% of our applications were pended because couldn't read the handwriting, plain and simple. This process, however, as you do an online application for the folks, or they do it, the documents that to verify their answers aren't needed. If there are questions, the Social Security Administration is going to follow up on it. If someone does submit a paper application and it's incomplete, Social Security will follow up by phone with that applicant. We all know that's not going to be a very speedy process. So we want to do as much online as possible. You have an opportunity to do this in multiple languages, but it is a great service for you to render for your prospects and clients, and gives you the opportunity then to make certain that you're controlling the sales process. That's how it looks online versus the paper. This is a notification letter that they get. These are some of the different sites that you can use as reference for information. I'm going through this really quickly, but you'll have this access to this recording, and you'll be able to access this in that fashion as well. So there are a number of different reference materials that can help you. Some of these can be very helpful as third-party endorsement, in a manner of speaking, can help you in your marketing practices within the community as well. And if you are one of the folks that are comfortable speaking with groups, either live or through the internet, National Council on Aging has really cool presentations for Low Income Subsidy, a Medicare or a Low Income Subsidy 101 program that you can put your information on and have the detail there for you as a sales track to follow, in a manner of speaking. It's not a true sales track, it's an education track, and it walks you right through the process. We have that same sort of information that's being available for the Medicare savings programs. These are an increasingly important area of emphasis when we talk about assistance programs for medications. Why? Well, enrollment in MAPD programs are increasing year over year, and generally that means you have fewer people in the PDP programs because they're taking the medication benefit through their MA plan. So we want to be prepared to address this within our prospects that aren't just a standalone PDP plan, not just a prescription drug plan, but that MAPD program, and that can make a huge difference for you. So this is one of the reasons why you want to go back to the people that you've enrolled into a Medicare Advantage prescription drug plan, because this can very well apply to them, as this graphic shows. It's a little dated, but you'll see that a whole bunch of the people that qualify for LIS are in an MAPD plan. So you need to follow up with each of the folks or each of the options that are available to them. And that's a big bunch of people, because If you're looking at some of the Medicare assistance programs that are Medicare Savings Plans, keep in mind, low income subsidy deals with drugs. Medicare savings programs deal with medical costs and drugs. And there's a large number of people that qualify for folks within the Medicare community for these programs. Some of them are already enrolled and don't really know what they have. Some of them may be eligible and aren't enrolled. And that's why familiarity with these are very important for us as well, because these are Medicaid administered programs, but they're done in conjunction with the state of residence and can be a big difference as to how some people have more money in their budget than if they don't, obviously. So this too is predicated upon income and assets. They can be called a number of different things in different areas. So when we talk about how is this labeled in Ohio versus Texas, or California versus New Hampshire, we'd want to make certain that we're using the proper language for your market state. And we want to make certain then that that is influencing our presentation. So we're using the language that's proper for our market. The qualified Medicare beneficiaries, you'll see in certain markets where you'll see a QMB or a QMB plus. They're a little bit different. And so that's one of the reasons why we want to look at state-specific information. A qualified Medicare beneficiary, this is the program within the Medicare savings programs that's been around the longest, created by legislation back in '88. And there's a majority of people that qualify for this that aren't enrolled. And this can make a huge difference for them. The specified low-income Medicare beneficiary, the SLMB, SLMBs, came about as presentation or through legislation 2 years after that. An even larger percentage of the folks that qualify for this don't have it in play. And then there are the qualifying individual ones, QI1s, that even go a little higher in the income stream. And knowing what the difference is between the benefit levels can make a big difference. And what are they? Well, this one can cover some cost and premiums. This covers premiums only. Premiums only. I'll get into more specifics in just a second. For someone to be eligible for these programs, they got to have Medicare Part A. They got to pass those income and resource tests. And keep in mind that 8 states don't have the assets test. So that can make a difference for you if you're working in those particular states. These are applications that are generally processed through the local Medicaid agencies. Many of them are located in Social Security offices. And like low income subsidy, eligibility is generally redetermined each year within the first couple 2-3 months of the year. What these do is they take care of that Part B late enrollment penalty if applicable, and it is different than what you will see with some folks that deal with long-term care and they speak of Medicaid spend down. This is a different animal in that area, in the fact that, one, there's no estate recovery with these folks. And for folks that qualify for this assistance program, they automatically get that help with the medication cost, as I mentioned before. You got a whole bunch of governmental agencies that come into play here. So you got CMS dealing with the local states on some of the different programs. How this is being funded comes between the government entities that are involved. The state Medicaid agencies administer these programs and they determine the eligibility. They're the ones that make some of the payments on behalf of the individuals that qualify for these help. So that's a big difference where you don't have to deal with the feds, at least in this animal. It's with your state folks. Much as what we saw, really neat pieces from the National Council on Aging for the low income subsidy. We have similar documents available eventually from the National Council on Aging. And you'll notice that, yeah, it's not available yet because normally I don't see this until February. In the old days, It used to be almost into April before we could see some of these numbers. And it goes through, the different states and the different levels that are out there for it and how that can vary from state to state. This is an illustration that really tells us that we need to be careful about what market we're in, because here this gives us kind of a detailing of what are these different levels called in different states. So it's lipstick on a pig in a manner of speaking. But if we're marketing in the state of Maine, we want to realize that Slim Bs and QI1s are together in a singular program. And that if we're marketing in Maryland, the QI1 program is called Slim B2. So it can be a different nomenclature with how these plans are laid out for us. Keep in mind, the Medicare savings programs do exclude primary residence and one car. I just like to show this graphic because I think it's kind of cool. You in this area will run into managed care for the Medicaid product. It's the big push across the country. You see carriers out there that are managing the Medicaid portion of a person's benefit package if they qualify for it. Now, keep in mind, these numbers that are here are for Medicaid, not Medicare Medicaid. So you have under 65 non-eligibles there, but you see what a huge market this is for the carriers. And what this does for us as agents, well, it gives us an idea of, well, gee, if Centene's got all that business in the Medicaid arena, that means they might have a contract in my market. That means that WellCare or whatever program label there is that I'm accustomed to in my market, well, they might have marketing programs aimed at this community. So it's a bit of a tip of the hat to, well, here, this is one way to go. This is one of the reasons why we want to maintain great relationships with the local management of the different carriers, because they may have a lead supply based off of a dual beneficiary market. You do also have, in a limited number of states, a program that's a Medicare Medicaid plan, an MMP program that takes people out of our marketing pool. What do I mean by that? Well, I reside in the great state of Texas, and you'll see that there's a number of people that are enrolled in these programs that, depending upon your market within Texas, you may or may not be commissionable for certain products. And if someone is taken by this third-party administrator and put in one of these programs, it could be one of your prospects or clients as well. So we want to be aware of the fact that, gee, in Texas, these are called Star Plus plans. Who's the company that's responsible for them? How do I make certain that I am not wasting my time with certain people? And that's kind of cold-blooded, but hey, how do I make certain that I'm marketing properly and I'm aware of the fact that if I walk into a house and they have an MMB plan, or if they're in a managed care program, they already have a card that says, here's my benefits. Well, look at the card. It might be their Medicaid benefit or one of these programs, and they may still be a prospect for you if it's the managed care for Medicaid. If they're in one of these, they're not a prospect. You have some folks that we talk about the number of people that are eligible and don't have these benefits. Well, there's a number of reasons. One, they might not know what's available, or they might have been made aware of them, and they say, okay, that's a 14-page application, I'm not doing it. Or they may be willing to try to do that, but they can't get someplace that can help them with it. And then, of course, we're dealing with pride, and we want to make certain that folks realize that this is an entitlement program and then they're not being placed on welfare. You can do some things to help people qualify for these as well. We talked about, okay, the forms are processed through Medicaid offices, a lot of times through Social Security locations. Well, you can direct people to those Social Security offices, hoping that the social worker is going to help. Good luck with that. Their schedules are really full. The pandemic's really changed staffing and everything else, and hours and everything. Well, that makes it a little interesting. But you have, as I mentioned before, sometimes co-branded or white-papered benefits checkup programs through different carriers, or United has their My Advocate program that can help get people qualified as well. Keep in mind, while we partner with carriers, sometimes we want to make certain that we maintain control of our prospects and clients, and so we're proactive in the system itself. We're not going to dive into dual special needs programs any more than this one slide. We have a presentation next week on D-SNPs, but depending upon the level of qualification within a Medicare Savings Program, that might be a crucial factor as to whether or not someone qualifies for full advantage of that dual special needs plan, where they have the A and the B. They qualify for the normal level of assistance. They reside in that service area. And this is a requirement that's gone away on regular MAPD plans. It can still be a factor in some D-SNP plans, so be aware of that. And it can make a big difference because, well, dealing with end-stage renal can be pretty expensive. We want to make certain that we're doing things to help people. For folks that are out there and say, okay, John, we talked about, the drug programs, and, I'm interested in how that can help me with my Med Sup business. If someone has a Medicare Savings Plan, do they need a Med Sup? No, that's actually illegal to do. So you have someone with this. If you got someone who's coming off a Medigap, you can actually suspend that for 2 years because the qualifications may vary for the folks year over year. But we want to make certain that folks realize that if they got a Med Sup or if they have a Medicare Savings Plan, you're not selling them a Med Sup. They don't need it. And you can get in hot water for it. As I mentioned before, the different levels of assistance with these programs, the QMB status, that does cover their Part B premium, and it covers deductibles and co-insurance that they have with their programs. The Slim Bs and the QI1s, that only pays that Part B premium. I say only pays. If you look at that Part B premium as a percentage of their monthly income, and you're able to get that covered through these programs, and you're bumping their income substantially, and that can make a difference for some of these folks as to whether or not they have a meal the last week or so. So we want to make certain that we're doing what's necessary to help people and do so on an informed basis. You have resources here too that you can access, and you can go through the National Council on Aging for different pieces as well that can make a nice difference, not just in some of the programs that we discussed, but if you get into some of the lower income folks, you can deal with SNAP programs, used to be called food stamps, energy assistance programs, all kinds of pieces of assistance for the lower income people. And remember those National Council on Aging presentations for LIS? Well, you got one for MSP as well, but you have some of those available for those other programs. So SNAP and some of the other pieces that can make a difference and be part of your repertoire as you go into the community and do presentations. Why do you want to do all that with us? Well, we're going to make certain that as you encounter the different needs for products, you have an easy way to do so, to pick up additional programs and do so electronically to get it done quickly. And where do we do that? Through our Sure LC program, Surance Bay. And it's a way for you to do some things electronically, create an agent profile, really speeds up the process as you put your stuff in a place where you can find it. We do offer discounted errors and omissions coverage for qualified agents. What makes you a qualified agent? You got to contract with us, but it's a program you own. So it's not like being an add to a blanket E&O policy for just one program and you got to figure out, oh man, how am I going to cover this for the requirements for the other insurance companies that I don't deal with this particular marketing organization for? Well, this is going to take care of that for you. We do also offer bundled discounted continuing education programs through our association with WebCE to keep your license in play. You have an opportunity to add to your own benefit package through a modified guarantee issue disability income plan as well for yourself, where you're paid a commission on business on yourself. Much as where today's presentation is being recorded, past presentations have been as well. So I talk about, okay, here's the presentations for LIS. Here's the presentations for MSP. John, you're using acronyms. What are you talking about? Here's the presentation for low income subsidy. Here's the presentation for Medicare Savings Plans. What are you going to do with them? Well, let's approach faith-based organizations or other centers of influence, and we may well have recorded presentations on how to do that in the past. Well, we have, and they're available on our website and on our YouTube channel 24/7. Much as where today's presentation will eventually make it there as well. We also have a page on our website that I really want to make you aware of, and it's the page that tells you about, are there any extra compensation for some of these programs? Well, not for MA or PDP plans, but there may well be for MedSup or ancillary programs. And we want to make certain that you are aware of those additional incentives and how they may help you qualify for carrier trips or for incentive programs that we offer at Premier as well, marketing support or the reintroduction of our trip as well. Well, gee, I like that slide so much, I put it in there twice. Some of the different lead programs that we have for you. Well, you can get a custom call list. If you are a friend of Ma Bell and don't mind doing that, it can be made available to you at low or no cost, depending upon your contracting situation and your arrangement with your marketer. Butt it up against do not call, so you're compliant, and it's not like a call center from another part of the world dialing in and going, I don't care about regulations. We follow the rules. As I mentioned in the recording pieces of it, we do have the marketing programs that help you maximize the value of retail marketing. Okay, so you worked at Walmart or Kroger or whatever, and yesterday was your last day of responsibility. Well, it's your last day of responsibility of being in that store. It's not the last day of responsibility of working that opportunity. We speak to how you can maximize that value, how you can approach faith-based organizations, work with providers, deal with prospects generated by the carriers that are delivered to you on a symbiotic relationship. We do offer internet leads. We do offer direct mail support, a T65 locator, and a referral program, and a really cool program through our Medicare Center that we'll talk about in a second too. Gee, I like that slide so much I left it in there twice too. That electronic tool device, well, gee, that's Medicare Center in a single tool that's available to you with a universal login for multiple quoting engines. It gives you that opportunity to do little side-by-side comparisons, collect that scope of appointment and that call recording and store it for that 10-year period. It gives you that microsite, that personal URL for presence out on the World Wide Web. It has that contact management system within it that even has switcher tags that designate which of your prospects and clients are most susceptible for a change. Lead Center. We'll talk about that in a little bit of a detail in just a moment. That comes as part of it, but it's also got in there different resources to help you be better at what you do. Some of the things that we find is, okay, we have a successful sales process. It works so well, there's got to be a better way to do it. Sometimes we need to go back to the fundamentals and reread and redo some things and see how it can work for us in the most conducive manner. And it is available as a mobile application as well. Did I mention the fact that it's available without cost to you, or in the words of JJ Walker on TV, it's free? Available to agents contracted through our organization or our integrity partners. Man. Lead vendors. When we talk about mail, if you're going through the mail support program that we have here at Premier, it is based on production, and it is a program that drives down the cost of that mail so you can do it consistently. Because direct mail is like an exercise program. You do it just once in a while, you feel a little bit of pain. You do it consistently, that's where you see the results. And you can actually qualify for this assistance through health programs and through final expense programs as well. We work through vetted lead vendors to make certain that it works for you. and that the programs they have can support and get you those leads back as quickly as possible. And we have the oversight to make certain that it's being done compliantly. We have also a lead program that is a direct mail, not accessed or utilized, well, fresh is what I'm trying to say, mail returns through one of our partners that is very cost effective and can help you plug holes in your calendar. I talked or alluded to this a couple of times. The Lead Center program is actually available through Medicare Center, and it is a system where you can do live transfers or you can do documented leads, however you want to put that, and you control it on and off with a cost that is very reasonable and periodically on sale. So it's a great way for you to get additional leads in that fashion really quickly as well. The internet lead programs that we have, they are Facebook based. There's one for both final expense and for Medicare. One of the things that we're seeing with such an emphasis on a lot of social media lead generation is competition is fierce, and you really need to respond as quickly as possible in order to maximize the value of those leads. That T65 locator, this is a program that you download to your smartphone or your desktop or whatever. You register, they see that you have a contract with us, it's made available to you free, and it gives you then the opportunity to plug out in a particular area where people that match the parameters that you put in here as to age and whatever else it happens to be, where they are in an area. So if you are stacking appointments, you're doing face-to-face appointments in an area and one cancels on you, well, it gives you the opportunity to see, okay, is there a 64-year-old in here? I'll go knock on the door and say, hey, I'm offering dental programs, because you can door knock for dental, you can door knock for final expense, and it's a great way to make certain that you're maximizing the use of your time. The referral programs that I keep mentioning, it's a revisit of, hey, this is what I need to do in order to take one lead and cast it upon the water and let it go forth and multiply, and let's bung up all kinds of different analogies there. But it's a great way for us to grow a lead into multiple leads by simply asking questions at key times in the process for not just the folks that you're visiting with to sell, but when you go back and visit with your book of business. We do all this because we want your business. We want to be referable to you as well. And these programs that we spoke of today with low income subsidy and Medicare savings programs, you don't certify for them. There's something you can put into play really, really quickly. It does require a bit of study on your part to make certain that you know what you're talking about, but it's an effortless way, in a manner of speaking, of going back to people you've already talked to and opening the door for additional business and cementing it through the use of programs that are out there that they may not be aware of, and you are the source of for them, creating additional markets. So at this point in time, I'm going to check and make certain that there may not be questions, or there may be questions. Nope, we're covered. Keep in mind, you're going to be receiving some follow-up to make certain that you have the detail here. You can reach us at 1-800-365-8208 and visit with your agent success manager, your marketer within Premier. If you don't have a marketer, we'll set you up with one to do so. But at this point in time, I want to thank you for coming on with us today. If you're an individual that's done business with us here at Premier in the past, I thank you for that business. I really appreciate it. I hope we're able to even deepen that relationship. For those of you that haven't done business with us, I look forward to the opportunity to do so. But all said and done, I want to thank you for the investment of your most valuable resource, and that's your time. Greatly appreciated right after the end of AEP. Thank you. Greatly, greatly appreciated. And so until we're able to speak again, I wish you good selling. Thanks so very much. We'll talk to you soon.